So your son has severe asthma. Um, if his asthma is occurring mainly during this allergy season, so it's a spring and fall, then there's a strong correlation between um, allergies to pollen as well as mold in the air and asthma. And that's one thing important to understand, that there are different kinds of asthma. There's the allergic type and there is the non-allergic. So asthma can be triggered by things like cold air, exercise, uh, infections and viruses especially. But you'll see in the other kinds of asthma that it tends to occur throughout the year, and it tends to be worse during the winter time. So if you notice that there is worsening asthma during the spring, summer, and fall compared to the winter time frame, that's a strong indication that there is an allergic component, and that the asthma can be much better controlled by controlling the allergies. And there are different kinds of ways to control allergies for asthma, and that can range from regular medications and inhalers, which I'm sure you're aware of, but there are other options and new treatments like biologics and other things, and allergy shots, as that can also offer a great benefit to somebody who has asthma and allergies. So hope this answers your questions. Hopefully we didn't crash here. Oops. A little difficulty again here, it seems like. One component crash on me. We can get it back fairly quickly. Yeah, it's back. Let's see if this got Audrey back. I'm missing the other inputs here. Let's see if we have to do this. Okay. Step on making sure. Just gonna move some of the questions to a list here so we can try not to miss anybody's. Keep them coming. Again, we'll try to go through as much as we can, and just hopefully with less crashes. All right, so let's do this one. Hi Becca, good morning. And let's see, you've never had allergies, as allergies have been crazy. Coughing for 3 weeks. Cough certainly is the manifestations of allergies, but especially if it's associated with some sneezing and itchy eyes, and it's happening during the allergy season. It's not uncommon that, as I mentioned earlier, we see asthma exacerbation or cough during those times as well. So if you haven't been tested or evaluated for allergies, that might be a good option to consider. You can also certainly try some over-the-counter allergy medications, which can vary from Claritin, Zyrtec, Allegra, or any of their generic counterparts, and even trying some of the new over-the-counter nose sprays like Flonase, and see if you get any relief of your cough. Now, if that persists or gets worsens, I think it'd be worthwhile to get that checked as well. Okay, and, let's see, we have Clara. Clara mentions that her son laughs and then wheezes, signs of asthma. It certainly can. Laughing, almost like exercise, in some patients, can trigger wheezing. Uh, One thing I always try to emphasize is asthma is not as much a disease as much as a symptom of things. So if you have someone who has reactive airways and they're twitchy, um, that's when you start seeing reaction and tightness and coughing triggered by different things, from dust, from heavy perfumes, or from cigarette smoke, from cold air, from exercise, from allergies. All of those can be triggering factors, and certainly laughing can be one. Um, Now, it, the other thing to keep in mind is if you have allergies to other things like dogs or pollen, then your likelihood of being irritated by other physical non-allergic triggers like exercise or laughing or cigarette smoke or perfumes can get worse during the allergy season, because your body is already irritated and is more likely to react with asthma symptoms. So, all right, this is Clara. Let's see who we have else. There's Chris, and her concern about is food allergy with non-food items. Not sure I understand the exact question, but eh, there are true food allergies from peanuts, eggs, milk, wheat, soybean, fish, shellfish, tree nuts. All of those can cause significant allergies. Now, there are some other non-allergic food reactions which can be triggered by things like lactose intolerance or gluten hypersensitivity kind of symptoms, or intolerance to preservatives or other things. But I wouldn't call them necessarily allergic responses. And the only way to find out with those non-actual food items is just based on the clinical symptoms you experience more than anything else. There are tests available for gluten, but at the end, you're really looking at the clinical effects of ingesting foods that have gluten, more so than the results of a blood test, and so on and so forth. There is an entity of food problem, we would call it. It has been linked to allergies. It's called eosinophilic esophagitis, which either we became more aware of it in the last few years, or it's something that's increasing. But it can trigger certain food intolerances that can sometimes be related to a positive allergy test to certain foods. But to diagnose something like that, you probably have to see a gastroenterologist or a pediatric gastroenterologist that might have to take a look down at the lower part of the esophagus where it goes in the stomach, and there are some kind of allergy cells that can indicate that problem. So, hope that helps. All right. Kim is asking about natural supplements. My view on supplements: if they don't hurt, it's okay to use. There could be some long-term benefits. However, most of the time, you have to realize that unfortunately there is not enough proper clinical research behind many of these supplements. Um, and, and the argument I always bring up is, if there is a supplement that has some true and effective and you know uh, curative or true clinical benefits, then I would find it hard to believe that somebody in our big pharmaceuticals and research with billions and billions of dollars have missed on the opportunity on finding out the true benefit and the actual component within that supplement that results in the benefit we see. Again, I don't have a problem with you using them, but I think they are sometimes overrated, and you might end up spending a lot of money with very little benefit. So, all right. Next, I have Stephanie. Stephanie has mentioned she has 4 children with. We just spoke about the eosinophilic esophagitis. It has genetic component of EOE. I think there's a lot we are learning about EOE. It's a fairly new entity. So again, I don't have a problem with genetic testing. There could be a familial tendency. We do know that allergies themselves have genetic component as well. So we do tend to see more allergies in families. If studies were done, for instance, if one parent has allergy, the risk of the child having allergy is about 30%. That risk can go up to 70% of both parents have allergies. It's not a simple 1 plus 1 equals 2. You can have a family with multiple children, but maybe one or two of 4 or 5 that actually have allergies. And this is more so many times with food allergies, where you can see one child develop it and the other does not. So again, not a straightforward answer for that, but there is definitely some genetic link associated with it. All right, let's see if we can get a couple more questions here. Just looking through the comment section. Sure, we're pulling those. All right, let's see what we have here. I can see there. Oh, glad those questions. So keep them coming, guys, and I'll try to go through as many as we can. You're welcome, Clara. Hear my dog in the background. My daughter trying to keep her quiet, but apparently not very successful. Right. Yep, got there. Welcome, Carol. All right. Again, there might be not an order, but again, I'll try to go through most, if any, all of them. This is a question from Stacy, and says if we can explain corn allergy in relation to food allergy a little further. Yeah, corn can be certainly an allergy. It also can be a pollen allergy. We see corn pollen, which is, by the way, is a grass. Um, it's from this grass family. So is wheat. So is oat. So is your Timothy grass that you on your lawn. Those are all grasses in many ways. So you can develop allergic respiratory allergies to these grasses, but especially during the grass season, which is in May and June. Although corn pollen tends to occur later in July time frame. Now, the food itself, it's extremely uncommon as a true what we call IgE mediated allergy. On the other hand, there's a very high possibility of that being an non-allergic reaction or an inflammation that might be triggered by corn-containing foods. In those scenarios, we also the only definitive way to determine such allergy is to undergo two phases. The first involves complete removal of corn or corn-containing foods from the diet, which can be tough but has to be done, and that has to be persistent for at least a period of 3 to 4 weeks. In addition to that, we have to reintroduce corn-containing foods in the diet after those 4 weeks. The determination comes when we have clear evidence of resolution of all problems and all symptoms when you take the corn out of your diet, but the symptoms come back when you bring it back in your diet. Some people even recommend doing this twice, on, off, on, twice, to actually confirm if that's truly a factor or not. The best way to do it is what we call a double-blind introduction, but unfortunately, from a practical way, this is not easy to do, because a double-blind removal and introduction would mean that neither the physician or healthcare provider nor the patient or the guardian know if the food being ingested has the corn in it or not. So this is what is called a double-blind placebo food challenge, and although we do that for testing true allergic food reactions, it's also applicable to scenarios like these. But again, setting up something as a double-blind that's going to occur over a period of time, especially if the symptoms don't occur right away, can be a little difficult. But ultimately, if something that impacts your life, it might be worth considering something like that. So, all right. Well, hi Linda, and good morning. Good to see you too as well. And another question here we have from Tara saying what's the treatment best for nasal drainage in the back of the throat? Allergies is only a part of the problem, and many times with the drainage from post-nasal drip, or what we call it. There are other consideration. Keep in mind, acid reflux can be a factor. So the kind of diet you have, if you're drinking certain things like coffee or pop, trying to eliminate, again, as a trial basis, and see if that impacts that drainage could be worthwhile. Having the drainage alone is not by itself an indication of underlying sinus infection. It'd be very unusual if that's the case. As far as other options and treatments, the best I would recommend is to make sure that you're always well hydrated, drinking lots of water, to make sure that the mucus itself is not um, of thicker consistency. Um, a normal person produces about the equivalent of a large um, bottle of pop of mucus and secretions from the upper airways every single day. We are mostly not aware of it, so it's just, you swallow unconsciously or subconsciously, and everybody just goes on doing the things they do. However, if the consistency of that mucus is altered in some way or another, um, again by allergies or by certain foods or by exposure to certain environmental irritants like perfumes and smoke and all of that, then the consistency can change and you become more aware of it, and can be a problem. So it's a difficult issue, but hopefully those tips can help with your problem. Um, Audrey is asking about if she can become allergic to the sun as we get older. There is true sun or solar urticaria, which is an allergic response to the sun. Um, and typically we see that in the early springtime. People who have true sun allergy many times start developing rashes and itching in sun exposed areas at the beginning of the sun season or the springtime frame. It also tends to decrease every year as we get through the later parts of the spring and the summer. It's like everything else we deal with many times, is you can get desensitized by gradual small amount of exposure to the sun. Again, not to getting yourself burned or anything like that, but to help you know reduce your discomfort they experience with that. The other thing that I've tried that with some of my patients with good success to consider is small amount of tanning. Not to get tanned, but again, a very minimal exposure to tanning booth, maybe about 1 or 2 minutes a week, especially during the winter time frame, might help decrease the chances that you will become or develop more symptoms as the season progresses. So, yeah, good question, and hopefully got some answers. Stephanie has a couple of questions. She has issues about shrimp, walnuts. Those are very serious, um, very serious issues, and I definitely would not recommend that you take any foods that contain nuts at this point, or seafood, and definitely get evaluated for possibly what we consider a life-threatening allergy. So definitely talk to your doctor or your allergist and get that checked out. Another question from another Stephanie is if you have a food allergy to milk, could you react to those ingredients in lotion or soaps type product? This applies to milk and to many food allergies, including peanuts and other things. The true serious reactions from food allergies that like milk and peanuts occurs from the ingestion of those foods. However, if you come in contact with the skin, it might irritate it, it might cause a hive or itching, but it's not going to cause, in 99.9% of people, what we call a life-threatening or anaphylactic reaction. So the ingestion is where the high risk is, but you can still develop reactions from on the skin, just like a mosquito bite reaction, but in most cases. Um, and for those, they might be uncomfortable enough that you have to avoid them as well. Right. Let's see. Let's go through the list here. Got Stephanie. And we have Kelly. Smaller type here for me. Again, these non-organic artificial components like potassium benzoate and other preservatives, sulfites, you can certainly have intolerance, non-IgE or anaphylactic type reactions to them. Unfortunately, there is no direct way to test for it. It's based on, again, similar to what I mentioned earlier. You go through the avoidance for a few weeks, then reintroduction. Do that maybe a couple of times, and to try to see if you notice any significant difference. And it's going to be on each person individually with that. So. All right, let's see what else we have. Looks like frozen, hopefully not for long. That spinning wheel is not a good sign. So. Going to the actual Facebook page itself and see if we can pull some of those. I'm gonna have to restart that. If it would let me. It crashed. Actually, turn off that thing behind me. That was my wife asking me if I'm still online. I'm still online. All right, let's take that. Polling thing if I can. I guess I hope I didn't crash it again. It looks like it's frozen. Nope, it's not. Reactions. Add that. working nicely. Take that off. Comments. Oh, there it is up here. That's why. Oh, it shrunk. Oh, got it. There they are. All right. Let's do this. Oh. Open the playlist. Okay, got some Daniela. Humidifier. Just moving a couple of the questions over. You're welcome, Audrey. Welcome, Tara. That. All right. Let's get that back to live. Stephanie had some scratch testing done by ENT for mental allergies, non-reactive. You know, you can have false negative. Worsening symptoms during the last week certainly bode well for underlying allergies. I know there is some differences at times between testing done by the ENTs and allergists in the area, so that's, or in whatever you're at, that's something that you might want to consider. But again, the timing, and if your symptoms have consistent with environmental allergies, whether it's sneezing, itchy eyes, itchy nose, then certainly that's maybe worth looking at again. Chris, asking about reading labels on food in the grocery store. Natural flavor is hard to understand. I agree. We've come a long way for food labeling, with the FDA now requiring, clearly stating if the certain foods contain peanuts or may contain or maybe contaminated with nuts or other things. But there is certainly just natural is considered, I would say, inadequate, and hopefully at sometime in the near future, certain terms like that would not be allowed to be on food labels. On that particular subject, keep in mind if a product says may contain tree nuts or peanuts, and you say the experience that yourself or your child has ingested the same product in the past and had no problem, just be aware there's no guarantee that the next time you eat it, if you're allergic to that component, that you would not react. The labeling basically just states that that product may contain. And when they looked at, for instance, 100,000 bars of a certain product, they might have found contamination in one of them. So the risks are fairly low. You can go a lifetime of eating those products without having a reaction, but you should be aware that the risk of eating them is higher than normal because they can contain a contaminated portion, and it just depends on your luck which bar you pick. So the best advice would be is to avoid those as well. although you have not had a problem eating them in the past. Welcome, Stephanie. Welcome, Kelly. And Audrey, everybody. All right, next is Stacy. Can food allergies cause gastrointestinal symptoms, occasional itchy eyes, ears, and mouth? Absolutely, you can get gastrointestinal symptoms with both true food allergy. So that's one of the symptoms you look at if you're allergic to a food, is to develop stomach discomfort, vomiting, diarrhea, in addition to sometimes developing rashes or itching or difficulty breathing or and severe reactions, becoming unconscious. Again, that would be a true allergic reaction. On the other hand, you can still have gastrointestinal symptoms alone with upset stomach that may indicate a food intolerance and not true food allergy. Again, testing many times will help differentiate between those two types. So, the other component to remember with certain food or so-called food allergy is the oral allergy syndrome, which is you develop itchy in the mouth and the ears after eating certain fruits. And the reason for that is many times the lining of the outer part of the fruit many times have similarity to certain pollen allergies. So it's not uncommon for somebody who has birch tree pollen allergy to experience itching in their mouth after eating an unpeeled apple. And that's especially more likely to occur during the birch pollen season in the spring time frame. Similarly, if you have ragweed pollen allergy, you're more likely to experience itching in the mouth and throat and ears after eating certain foods like strawberries and cantaloupes and watermelon. The symptoms of oral allergy syndrome can be very strong, but certainly can also benefit from treating the environmental allergies. And we commonly see that in our patients where we've had those patients with strong environmental allergies being treated for that with allergy shots, and they oral allergy syndromes improve significantly or resolve. So, Audrey's asking about if I would recommend a humidifier for asthma patients. Not generally. You want to keep the humidity level in the house around under 50%. 35 to 40% is a good thing. So if you get higher humidity above that, you'll end up with increased dust mites and possibly mold growth in that area. So both of these can be bad for asthma or for allergies in general. On the other hand, if you air gets too dry, say in the winter time when temperature drops, very dry air can be an irritant and can exacerbate asthma symptoms and can be a problem. It also has issues with making eczema worse and your skin dry and all kinds of other things. So in general, I do recommend that you get from any of your local hardware stores a simple thermometer with a humidity gauge on it. Those generally run anywhere from $10 to $15, and you don't have to spend a lot on them. But the nice thing is you'll be able to carry them from one part of the house to the other to determine what the humidity is at that point. Humidity is not like temperature. It's not many times uniform throughout the house. So if you're next to the sink or next to the bathroom, you're going to have higher humidity than other areas. And the humidity or the humidifier on your furnace adds some moisture to the air, especially during the winter time, but being high or low really has no correlation what the humidity level is at any point. So Daniela is asking about ascorbic acid, and I'm assuming as an allergen or a supplement. There is no specific testing for it. Ascorbic acid is vitamin C. Is certainly is been shown to have some clinical benefit on the vitality of your immune cells, just similar to any other diet in many ways. Some people advocate higher doses of vitamin C during colds and other things, including my mom, by the way. Again, the scientific clear evidence from that is not there. Only one that has some clinical based studies behind the benefit is the zinc supplements. Those, at least in some studies, have been shown to maybe shorten the duration of your cold symptoms, let's say from 4 days to 3 days, something like that. But again, I wouldn't expect a magical relief with that. So, well, this has been very exciting thing. It's the first time we are doing this live, and I'm so glad to see so many people interested and have some very important questions, and I hope we've answered to the best we can as what the best way to handle those. I definitely will be doing this again. So I have to work out through some of those technical issues, but I promise it's gonna be hopefully smoother sailing next time. If you have any special requests or certain things to discuss, please feel free to leave comments on Facebook at any time, and I'll be checking those as well. Meanwhile, I think we're gonna end this live broadcast, and I wish you all a wonderful weekend, and until next time, wish you all the best. Thank you. Bye bye.